All right, hello. Today I'm going to be talking to you guys about chronic kidney disease. Firstly, what is chronic kidney disease? It is a condition where a patient's GFR rate is less than 60 mLs per minute, and this can lead to accumulation of metabolic wastes, also known as azotemia. Azo standing for nitrogen, so it's when nitrogen starts to build up, and it can cause nausea, vomiting, confusion, and seizures. And GFR, or glomerular filtration rate, is a very important thing to measure because it is measured via serum creatinine, which is a waste product that can build up in the blood when the kidneys start to damage, which is not good. And then you have this other value that's very important. The National Kidney Foundation says the GFR rate and the UACR rate are very important. The UACR rate stands for urine albumin creatinine ratio, and this measures if you have albumin in your urine. And albumin is a very important component in your blood because this helps prevent fluid leaking from occurring, and it can help your blood circulation. So if albumin is starting to appear in your urine, then that is not good. That can actually lead to a higher risk of fluid leakage from occurring. And it's important to keep very high GFR rates and low UACR rates to prevent risk of any CKD. Clinical manifestations of CKD include the sodium and water balance, potassium balance, metabolic acidosis, and mineral balance. Those are the four major components that can give you just some sort of hint that you may have symptoms of CKD. So regarding sodium and water balance, a patient with CKD typically will have a very low GFR rate, and when this happens, it can cause an increase in sodium and water retention, which can cause an increase in blood pressure. So when this happens, we typically try to tell patients to prevent intake of fluid. But if there's a situation where a patient is trying to vomit, they're going to lose a lot of that fluid, and because they're not intaking as much fluid and they're now losing that fluid, then they have to undergo an emergency procedure. It's a very dangerous situation that can happen because they have a higher chance of getting organ stunning, which is when their organs are starting to damage, and they can also get hypovolemia. So that means they have to undergo dialysis so that we can increase the amount of fluid that is entering their body, so that we can prevent that from happening. And then we also have potassium balance. So for potassium balance, patients with CKD will end up having hyperkalemia, so they have a higher chance of getting cardiac arrhythmias, and can lead to muscle weakness. So in this case, regarding medications, they would have to avoid taking anything with any potassium-sparing diuretics or any ACE inhibitors, because potassium-sparing diuretics do inhibit the sodium-potassium pump. That's their mechanism of action. So what ends up happening is it increases the amount of potassium in their blood, and because the patient already has a very high CKD or has a very low GFR rate and high potassium in their blood, we don't want to increase the potassium by giving them a potassium-sparing diuretic, or it can cause a very severe change in their EKG, and we don't want that to happen. And then also, you don't want to take ACE inhibitors because it can also cause edema, and the patient usually with CKD will have swelling in the hands and feet, which we don't want that to happen, and we don't want it to overstimulate and make it worse. And then regarding metabolic acidosis, so balancing your electrolytes, your pH, when a patient has CKD, the kidneys cannot excrete hydrogen ions properly, and it cannot produce enough bicarbonate. So what ends up happening is the pH starts to lower a lot. So when this happens, then it can cause bone decalcification. And regarding mineral balance, when you're losing nephrons, it cannot produce enough calcitriol. So what's up happening is your parathyroid gland is gonna set off the alarms and be like, hey, we don't have enough calcitriol, so we're gonna produce more of it. We're gonna produce more of the parathyroid hormone to make up for the loss of calcitriol. But what's up happening is it actually causes more damage and causes hypocalcemia and breakdown of bone. So that's kind of just the overall idea of what CKD is, the symptoms and the clinical manifestations of it. So then we have the stages. We have 5 stages. So where each stage has different GFR rates. So the overall treatment goal for patients with CKD is to slow down, lower kidney damage, and keep them working as long as we can. So if a patient is in stage 1 or stage 2, typically they're not going to show any symptoms. They're going to feel pretty normal, which is great. If we're able to catch a patient that's in this stage, then we can just tell them to take on early healthy lifestyle habits to prevent it from going to further stages. But if they do go into stage 3, if a patient is in stage 3, then they're going to start to feel weak. They're going to start to feel swelling in hands and feet, so edema, and their urine will start to appear darker and foamy. So I I got this quote from this book that came in. So according to Kallenbach, who is the author of this book, states that it's important for the nephrologist to evaluate any medication dosage adjustments necessitated by a declining GFR, particularly for medications secreted by the kidneys, and they may make recommendations on diet, so sodium, phosphorus, and protein restriction as deemed appropriate for the patient. So that's a very important quote because it determines what the nephrologist may have to do to make certain changes on the patient that's in that stage. So, but if they then go on to stage 4, then they're going to feel a lot worse. They're going to have more swelling, pain in lower back, darker foamy urine. The reason why they're starting to have like more darker foamy urine is because urine is now starting to appear in the blood because the urinary system is not functioning properly. The kidneys are not filtering properly. So the urine is supposed to be excreted out of your body along with metabolic waste. But because it's not happening properly, then urine is actually going to start to build up in the blood, and they're actually going to start to have like that fishy like smell in their breath, and that's because of uremia. So for end-stage renal disease, or stage 5, the patient's kidneys have a very low GFR rate. It's less than 15 mLs per minute, and at this point, their kidneys are very damaged and are not functioning properly. So the best treatment option for this would have to be dialysis, peritoneal dialysis, which is in the abdomen region, or a kidney transplant. And that's it. So thank you so much. Bye.